The numbers have been numbing. There are so many and they are so large, they lose their impact. But let's take a look. Deaths from the coronavirus have increased nearly 23% from a week ago. The 7-day average now exceeds 1,000 per day. Daily cases are on the rise in 49 states and deaths per day are climbing in 39 of those. Bloomberg's Emma Court is part of our team covering coronavirus. Emma, on Bloomberg.com, you just published a story on how Republican leaders are using Trump's departure from the White House as cover for new restrictions. Explain to us how you're seeing this play out in red states.
Yeah, thank you so much for having me. I think what's really important to note is that we've seen a number of governors across both red and blue states taking some new kind of stricter measures around the coronavirus this week. But I think what's important to point out is, in particular, Republican governors moving closer to things like mask mandates, if not entirely taking a mask mandate, as we saw in Utah this past Sunday. And what's kind of critical here is, for one thing, the president is someone who has attacked governors in the past for taking stringent COVID precautions. But we are also seeing him really focus on, the election and not so much on COVID-19. And we're seeing governors kind of being put very much on the front lines of this issue as the COVID numbers just get so much worse.
And we'll get into that in a little bit, but tell me how that response from red states compares to how Democrats have approached the virus.
Yeah, it's a really good question. It's hard to make generalizations because there are so many governors, but we have seen in general Democratic governors perhaps being a little bit more willing to take aggressive virus measures. That doesn't mean all Republican governors haven't done that, but we have seen some Republican governors be more willing to do things like mask mandates than others. And we're seeing in particular some of the governors who have been very laissez-faire starting to implement more restrictions as things like the hospital system get kind of pushed to their limits by virus patients. So for instance, in Iowa and in South Dakota, we've seen those governors talking a little bit more about masks and talking about limiting gatherings. For instance, one new regulation announced this week limited gatherings, indoor gatherings of more than 25 people to wearing masks and social distancing. And that's something that I think, there's a lot of geographic variation here, right? So someone in New York, that might sound pretty crazy that only now are you saying people of more, gatherings of more than 25 people, need to be wearing masks indoors. And we know indoor gatherings are a huge source of spread because there isn't enough ventilation to kind of dissipate virus particles.
You're absolutely right. We're seeing so many more restrictions these days. But I think a big question on many people's minds is it too late for these governors to even get this under control in the first place?
It's the $1 million question, and there aren't really answers right now, unfortunately. There's a distinct possibility that even the measures being taken now, may not be effective enough given the size of the virus numbers we've been seeing lately. An important question also is, how long will it take to see the effects of some of these measures play out? These are things that are not immediate. And it really depends on how well they're communicated to the public. When you announce things that are, masks are required in X setting, but not kind of across the board, that might confuse people and you might not see that work as well. But we know from previous experiences with virus surges like over the summer that these are measures that, even if measures do work, they can take sometimes twice as long as the virus cases took to rise to come back down again. And that means a lot of pain and suffering and unfortunately, will mean deaths as well.
Now, walk us through how this presidential transition will factor into the U.S.'s COVID response.
Yeah, so it's a tricky time because we're talking about, the federal leadership transitioning. We have a president who's a lame duck president who's, contesting the election results and is probably unlikely to take a more hard line stance on the virus than he has already, which means it's kind of a power vacuum that we're facing here right now. And we've seen, President-elect Joe Biden talk a lot about a national COVID-19 response. It's something, public health experts have been pleading for months and months now. And there's some hopes that maybe, this stance might really kind of reverse the course of the pandemic. But there's a lot of time until January and until that inauguration for the virus to potentially get worse. And so it is a big question, how much worse are things going to get? And can, someone who takes office in January really do all that much to reverse that? We have seen some good news lately too, right? We had those results from Pfizer, from the vaccine on Monday. But there's still a lot of questions about exactly what's going on with that vaccine, and we'll hopefully have some more data and research soon. But we also have to think about the fact that a vaccine takes a lot of time to distribute, to roll out, and we won't have enough of the vaccine, at least in the beginning, assuming this vaccine does get cleared, to really vaccinate everyone in America. And that means that we're still going to be contending with this pandemic for some time.
All righty. Bloomberg's Emma Court, thank you so much for joining us.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.